I'm Anthony Phillips, a level 2 nursing student for Professor Paul Need's class. Today I'm going to be doing the tracheal suction video, and my 7 steps will be: my first step is check physician's order. Second step is to gather my equipment. My equipment's a garbage bag for my garbage, 2 clean gloves, a inner cannula, my catheter suction kit. I also have my cotton swabs, or my Q-tips, 2 drain sponges, a package of gauze sponges, normal saline, and hydrogen peroxide. My third step is to wash my hands. My fourth step is identify patient. Next step is to introduce myself to the patient. Next step is to explain the procedure to the patient. And my final step is to provide privacy for the patient. Okay, my patient's bed is down for time's sake. I raised the bed already. I also put him in a 45-degree semi-Fowler position. If my patient can, I'll have him sit up so I can auscultate his lungs, and if he can't, I'll roll him to the side. Pretend he's sitting up. I'm going to auscultate all 12 points on the back, doing the regular across formation. All 12. Next, what I'm going to do is to check my suction machine. What I'm going to do is clamp the tubing and turn on the machine. We're aiming for between 100 and 120. I'm going to leave the machine on. Next, what I'm going to do is open up my catheter suction kit. I'm going to open it away from me so it remains sterile. I'm going to take out my cup. I'm going to pour in normal saline. Now, I'm going to check the date on the saline. If it's expired, I'm going to toss it and use a new one. But this one's okay, so I'll just use this. Okay. Next, what I'm going to do is open the gloves. Throw out my wrapping. I'm going to take out my dominant glove first, making sure to stay under the brim. Next, I'm going to take out my other glove and stick my fingers under the brim. Pull it out. I agree. Now that I have my glove on, next thing I'm going to do is take out my catheter kit. What I'm going to do is, this is going to be my clean hand, and this is going to be my sterile hand. So I'm going to take this in my sterile hand, take the hose and the suction kit, and with my clean hand, insert it in. Okay. Now, let's stick with my clean hand, my sterile hand. What I'm going to do next is I'm going to turn off, or I'm going to leave the suction off. And I'm going to press to apply suction and suck up some saline just to see that it works intermittently. Okay. And then I'm going to go to my patient. I'm going to insert the catheter tubing into the trach. Until I feel resistance. And next what I'm going to do is I'm going to slowly pull it out and at the same time intermittently apply suction. Next, I'm going to suck up saline solution to flush the line. Now, if my patient needs more suction, I will repeat the process, but my patient sounds pretty clear, so I'm going to finish. So I'm going to first remove this tubing. Now, with my clean hand, throw that up. And then with my other hand, what I'm going to do is remove the dressing under the trach. Next thing I'm going to do is apply clean gloves. My hands are no longer sterile. These are clean gloves.
Invert my bag.
I'm going to remove patient's cannula.
Making sure it's unlocked.
Okay. I'm going to check the size. I'll throw this out. I'm going to open up my cannula, making sure that the size matches. When I grab the inner cannula, I grab from the wing so I don't contaminate it. And to not touch the sides. And the cannula in.
Scrub the patient's up.
Now the cannula's in. The next thing I'm going to do is to pour in. Next thing I'm going to do is to. Oh, I'll still take the lungs. All 12 lungs, or lung points.
I'm going to check my patient's IV site for any infiltration. Ask the patient if they need anything, if they're comfortable.
I'm going to check the patient's oxygen to see if he feels a little dizzy or anything like that. I'll reapply the oxygen if he's on oxygen. Next thing I'm going to do is take the inner cannula kit, or the container. I'm going to put in half of the saline solution, the same stuff I used before, so if that was expired I would have replaced it with a new one. Also I'm going to put in half hydrogen peroxide, so an equal of each. And I'm going to take out 2 cotton swabs, well, 1 cotton swab.
do it up to here. Up to here.
And dip it in the solution.
Open all the way here. That's a lot of fluid.
And I'm going to go first
That's for controlling
underneath
only.
the trach. I'm
I don't know if you noticed.
only going to go
all the way up and
from
drop
left to right once.
Yeah, but she
And then I'm going to throw this out.
I just made a chocolate.
Then, again, dip it in.
When you look at it,
I'm going to go on the top.
that's control. That controls the drip.
Yeah.
Because I do
Left,
But I
that's
just
all
don't
right.
have a drip to go by, so I
just say 31. You're doing 31 drip breaks in
Okay, next thing I'm going to do
1 minute. 30 drip breaks.
the gauze sponges. Now I have 2 sponges in here. I'm going to use one for the bottom to dry it.
I mean, like, I don't know how maybe everyone goes and then maybe one makes mistake, you're expecting me not make a mistake. I mean, yeah, I don't know.
And then I'm going to use the other one to dry the top.
Yeah, she didn't check that, that's why I was definitely.
definitely make sure you do the drip thing as soon as they wash.
Okay, now that it's dry, I'm going to take out a drain sponge. Now there's 2 in the pack, but I only need 1.
This is controlled. This is rocket, this controls
I'm going to try not to touch it too much, it's going to go near the stoma. Oh, while the dressing is off, I'm going to check the stoma for any redness, swelling, heat, signs of infection.
You're not the best with it, guys.
I'm
I
going
don't know
to
if you guys saw the video.
pressing.
We saw the video and did the pressing. Remember, like, they got everything prepared first? Yeah, but you didn't hook it up and then you really introduced yourself.
Oh, like carry it in.
Yeah. Because you introduced yourself and then you went back here.
You think we should be done already before you go into the room? I might be able to. Like have it open? You have it already run, right? Yeah, like just walk.
No,
Yeah, because they ran it.
no, what I meant, like, open it and, well, yeah, they, according to the video, they ran away.
Now that the dressing is underneath the trach, I'm going to take off my gloves.
Remember with all these measurement people, remember they were in different rooms, and they were in another different room.
And also take the lungs again to make sure the patient's breathing all right. And hopefully it sounds a little clearer with the suction. Okay, what I'm going to do now is cover the patient back up, ask them how they're feeling, how they tolerated the procedure, and then I'm going to lower the bed and also I'll make sure to, after I lower it, to document the secretions that came out with the drain, also how the stoma looked, how the patient tolerated the procedure, and yeah, that's it. Thank you.